Depending on the scope of work, surgery can take anywhere, on average, between an hour, hour and a half. Once that's done, we help you off the table, make sure that you have all the things you need, a pad. We usually send you home with a peri bottle, which you can fill with warm water and just sort of splash on the labial area after you go to the bathroom, just so that you're not, scrubbing or rubbing toilet paper on that area. We like to send you home with a friend or a family member. We do not send you home in a taxi or an Uber, so you have to make sure that you've got somebody lined up to drive you home because you will be too loopy to do that. In terms of recovery is not so bad. It's critical, though, that you do certain things during the recovery phase, or else you might run into a risk of complications. So one of the essential things to do during recovery is to ice. Certainly the first week of recovery, you need to have ice on that labial area as much as possible to reduce any kind of swelling, and it also does so good for pain. If you can extend it into a second week, you will benefit from that, but oftentimes people are returning to work on week 2. The other thing that I ask you to do during that first week is try not to sit. You don't want direct pressure on that labial area. So especially for that first week, I want you to be lounging and getting pressure off the labia or laying on your side. Even, in car rides, I don't want you going on long car rides. Maybe you can, take a 15, 20 minute car ride to the store. But longer than that, I don't want you driving. I also recommend getting a donut cushion. You can get those easily off, Amazon. But it's a cushion that you can sit on that has a hole in the middle so that when you sit on the cushion, there's less pressure on that labial area. So I'd love for you to use that in your recovery phase, especially for the first couple of weeks. There's going to be 6 full weeks of pelvic rest, meaning no sexual activity of any kind. Okay, you can kiss your partner, but that's it, no more. Leave that area alone for a full 6 weeks. You do not want to suffer any complications. You want to do this surgery once and not have to do it again. So no sexual activity for a full 6 weeks from the day of surgery. I only permit showers, no baths during this time. I don't want you immersing in water. So no baths, no pools, no hot tubs, nothing like that until you're cleared by me. But showering is okay as long as you're not scrubbing the area. Just let the soap and water run over that area. The other thing I tell my patients is the more you leave that area alone, the better you will heal. Just pretend the vulva and the vagina doesn't exist. Don't go looking, don't go touching. Literally, the more you leave it alone, the better you do. You do not have to put ointments or creams or anything like no antibiotic ointment. You don't need any of that. Just leave it alone. And then I'll see you 6 weeks post-operatively. And usually you are about 90 to 95% of the way there in terms of what things are going to look like. You still may have a little bit of swelling. It shouldn't be that much. And the tissues are still going to soften over time, over several months even. But usually at this point, people are super happy with the results. And this is when I typically clear you to go back to absolutely normal activities. So I hope that answers a lot of questions and hopefully calms some of your fears when it comes to getting a labiaplasty. But it's very straightforward, and you're going to do awesome.